Hello, welcome folks. We're just waiting a minute or here while people are clicking in. We're glad to have you. Just give it another 30 seconds or so. See who's all is still, the numbers still climbing here. So I just want to wait another minute. Thank you all for being here. Okay, I'm going to say we go ahead and get started. We've got a good number of folks here with us. Good afternoon. My name's Andrea Freeman. I'm the Policy Director with the Public Health Institute of Western Mass. We're really grateful that you're here today with us. I just have a couple notes about some housekeeping. If we could get the next slide there, Kelly. Here we go. We are indeed recording this webinar. We'll share it afterwards through our website and our newsletter, and we'll send it out to you and anybody else who is registered for the webinar. The chat is currently open. We'll leave it open. So feel free if you would like to add your name, your affiliation, so we could get a sense of who's here. Don't feel obliged if you don't want to, but we invite you to. And then also just want to let you know that we're asking that you hold your questions until the end. And if you do have a question that you'd like to share, to put it in to use the Q&A function at the bottom on your menu bar, rather than in the chat, at the risk of us losing it in the chat. Oh, this is great to see people putting their names in the chat. Thank you. And lastly, if you have any technical difficulties, if you could chat one of the either me or my colleague Kelly, we'll do the best we can to help you if you're having any technical difficulties. And lastly, we are going to have a feedback. We'll provide a link for a feedback survey towards the end of this session. And so with that, first off, I want to do is just find out a little bit about who's here today. And so if you're willing to, we've got two quick polls that I invite you to take to do the polls once you see it on your screen. But of course, if you're driving or you're juggling something, please don't worry about it. But if you are in a position to do this poll, we'd love to know which county that you do the most, that you focus on the most, whether it's where you live, where you work, but which county is most in your mind. Okay, so Kelly, we wait another 3 seconds. So we're going to close the poll now and see what we've got for results. Aha, we've got folks from all 4 Western Mass counties and some others. So thank you for everybody for sharing that. And glad to see that Hampden County is in the house, as well as Berkshire, Hampshire, and Franklin. The next poll, we just kind of like to get a little bit about what role or roles that you play with regards to youth mental health. So here's poll number 2, and this is where you can check all that apply. And if you're just joining us, we invite you to put your name and affiliation in the chat and also do the poll. Okay, we're going to close the poll in 5, 4, 3, 2, 1. Okay, look at these results. So glad to see we have some youth or young adults here. healthcare, behavioral health professionals, teachers, parents, caring adults, elected officials. And of course, I think we all have many other roles as well. So thank you for doing that. Thanks, Kelly, for getting those up there so nicely. So with that, I'm really delighted to turn the program over to the executive director of the Public Health Institute of Western Mass, Jessica Collins.
Hey, Andrea, thank you very much. Jessica Collins here, and really just thrilled to have everyone joining us. So appreciative of our speakers today and all of you joining to talk about youth mental health and how we can prioritize and work together collectively to advocate for policy that will impact our youth and families here in Western Mass. So thanks, Andrea, for kicking us off. Over the past year, we've been working together with many organizations, youth groups, different sectors involved in supporting youth and families, and many more to create a youth mental health roadmap that lifts up equity, prevention, and promotion strategies and solutions to our growing youth mental health challenges. Our roadmap called out 5 areas for action: social media, clinical and community linkages, social emotional learning in schools, destigmatizing the issue of mental health, and lastly, social connection. In the roadmap, we lifted up some current policies that have been prioritized by the Children's Mental Health Campaign, and we are thrilled and so very grateful to have Courtney here with us today. She leads the work of the Children's Mental Health Campaign, and we are grateful for her leadership, and actually her advice as we were developing the roadmap was absolutely critical. So I'd like to introduce Courtney Chelo. She has been with the Mass Society for the Prevention of Cruelty to Children for more than 9 years and is currently their Associate Director of Government Relations. In this role, she leads the Children's Mental Health Campaign, which she will be telling us about in a minute. And prior to her current role, Courtney was with Healthcare for All for several years, working on oral health policy and community organizing, which was critical and continues to be critical for Western Mass. So thanks, Courtney, for all you're doing across the state. And we'll hand it over to you for your presentation.
Wonderful. Thank you, Jessica and Andrea. Great to be here. Really appreciate the opportunity to speak with all of you today. And I see familiar names too in the participants list. So hello, old friends. It's nice to see you all here. I'm going to go ahead and pull up some slides quickly. Bear with me just a second. There we go. All right. As mentioned, I'm Courtney Chelo. I'm with the Mass Society for Prevention of Cruelty to Children. The MSPCC serves as the administrative home for the Children's Mental Health Campaign. So I am the only official full-time staff person working on the campaign, but we do have folks across 6 partner organizations, all lending a hand, helping to guide the work of the campaign. The executive committee, in addition to MSPCC, consists of Boston Children's Hospital, the Parent Professional Advocacy League, who are, of course, our ever-important family voice, Healthcare for All, Health Law Advocates, and the Mass Association for Mental Health. And so we are a network of about 250 organizations that work statewide to make sure that kids and families have access to the services and supports that they need when they need them. And so thinking about the when and where of it all, over these last few years, we've really started to adopt this comprehensive approach framework where we really are trying to focus on making sure that kids' needs are being met at home, at school, and in their community. I think those are all pretty straightforward, makes sense, right? We want to make sure that anywhere kids are, that they are getting the supports that they need that are appropriate for that setting. Too many kids go too long without getting access to the supports that they need. And so if we're really being thoughtful about targeting those spaces, we can really make inroads. And so I want to zoom into that middle green circle here. The campaign decided at the beginning of this legislative session to really put a significant focus on school-based behavioral health. And that is because one of the most promising methods of bridging that gap in services for young people is to meet them where they're at and provide those behavioral health services and supports within the school environment. So last session, we worked on about 14 bills. That was a lot. It was also, I think, recognition of the sort of open window of opportunity at the time to really make some big progress, and we were very successful, which is great. One of the key pieces that passed was the Mental Health ABC 2.0 bill, now known as Chapter 177, which included a bill that Rep. Decker had filed that the campaign did work on with her called the Thrives Act, which most notably codified the school-based behavioral health technical assistance center in the school space, as well as required districts with guidance from DESE to create a behavioral health crisis plan to go alongside their medical crisis plan. And that's really about bringing parity to the space, right? We want to make sure that a behavioral health crisis in school does not receive a police response, but receives a healthcare response, just like any other healthcare related emergency or incident. So that was really exciting and laid really great groundwork for this session. And now we have 3 bills that we are working on that we were very excited about. Sort of the big bill, and I'm going to kind of reverse our order here and talk about this one last, but the big bill is this Child and Adolescent Behavioral Health Implementation Coordinating Council. Second is our mass health reimbursement for schools, and third is the promotion of mental health education curriculum in schools. And so I'm going to just dive into those because I know we don't have a ton of time and I want to give you a little background. So this school-based Medicaid bill. So as it stands right now, schools can, because of the free care rule, bill municipal Medicaid for services provided in school, as long as they fall within all of the appropriate categories and are delivered by licensed staff who can bill Medicaid. The problem here is that when districts bill Medicaid, those resources cannot be directed by Mass Health. It is unrestricted funding that goes back to the local educational authority, which is the municipality. It's the city or town that the school resides within. For those of you who are school finance pros, I apologize that this is probably redundant knowledge for you. I have learned a lot in this space over the last couple of years. So it was all new to me. What that means essentially is that because these resources are not going back to the school necessarily, that can be a real barrier to getting schools to participate in school Medicaid, and even for those that do participate, to really get them to maximize their participation. And that means that we're leaving federal funds on the table. The last full year that we have data for, which is 2021-22, the state brought in about $80 million in school Medicaid reimbursement, which is no small amount of money. And that is without really maximizing this resource. So that means we're leaving a significant amount of federal dollars on the table. And we don't want to do that, right? We know that schools struggle enough for funds. We want to make sure that those resources are coming back to the state, and more specifically, coming back to support school health and make those programs more robust. There are some cities and towns that have made agreements with their school district that funds coming back through school Medicaid will get filtered back into the district, which is fantastic. We don't want to see schools have to negotiate that on a town by town, city by city basis, right? There are just too many districts. We have 406 across the state. It'll take forever to negotiate that place by place. And we hear over and over again, school staff are stressed. There's a lot going on. There are a lot of demands on their time. If these resources were coming back to support the school, it would make a much more compelling case for schools to dedicate the time and effort and energy to actually maximize that reimbursement. But because that isn't the place, or the way things are right now, it's just not happening the way that we would like to see. We feel like this is the ideal time to pass this legislation to require that these resources go back to schools and are specifically earmarked towards school health. One, because we are in a pediatric behavioral health crisis. We need resources in schools. There are also a number of other initiatives happening in schools, right, that could use more resources to help keep our kids safe and well. And there are also some new and some forthcoming state and federal efforts, including some new guidelines from the feds that include new flexibility and opportunity to reduce the administrative burden that currently exists, which will make it a lot easier for schools to participate, even if those resources aren't coming back. And I think, as we start to see that maximized, again, all the more important that we're making sure now that those resources are marked to go back to school to support school health. Yeah, that is that piece. And we've been lucky to work with Senator Moran on the bill to really officially make that happen in the Senate, and working with Rep. Garlick on the House side, who is also the chair of the Education Committee. And she has filed this resolve to create a task force that's really action oriented to create study and recommendations around this as sort of a fallback. But we're really hoping that this is the session and we get to see this move forward. Something that the school nurses have been working on for a long time. They've had a great coordinated effort around this. And we were very fortunate to get to partner with them and some of the other allied school health professionals to expand that language to all school health services. So next up is an act relative to mental health education, working with Rep. Higgins and Rep. Kilcoyne on the House side and Senator Collins over in the Senate. And this bill, really straightforward. I think it is maybe the shortest bill I've ever worked on. It just adds a requirement to the physical education requirement in the state law that students also receive mental health education that is developmentally appropriate. That's it. That is really all. We are not overly prescriptive, and that is on purpose. Local control is really important to schools. And we know that, the curriculum that is going to work in Springfield is going to look a lot different than what is going to work out in Cape Cod, right? So we want to make sure that we're being thoughtful about that and not sort of burdening schools by creating a requirement for a certain curriculum that just isn't going to work for them. Nice to see you, Senator. Welcome. And so, we really want to make sure students are getting this information. We want to make sure it's doable for the schools. The other thing that we have kind of incorporated into this is a cross-curriculum approach. So a district could adopt a standalone mental health education class. It could be woven into the health curriculum. And it could also be a curriculum, there are evidence-based ones out there that weave it in throughout the other courses that are required that students are already taking, weaving it into lessons around math, biology, literature, everything else. So lots of adaptable, interesting approaches out there that, there's no one size fits all, but there is something out there for each district that could be workable. And we think this is more important now than ever. We know that kids are struggling, right? The pandemic was challenging for everybody, and the lingering anxiety and concern that sprung from that is going to have ripple effects for a long time. And that can be really challenging if you don't understand what's happening inside of you, right? Which is basically what it's like to be a teenager, but this is just compounded many times over. We really want to make sure that we have these resources in place for kids, because there are a number of studies that show that not only does teaching about mental health decrease stigma, but it also increases a young person's sort of self-knowledge and leads to kids coming forward sooner when they are having a hard time and they ask for help. And we want to make sure that when they do that, there are also resources in place for them to get that support. So that leads us to the third and final bill. And like I said, this is our big one, an act establishing a Child and Adolescent Behavioral Health Implementation Coordinating Council. I do keep joking that we really didn't pick a name that rolls off the tongue for the bill that I have to call by name most frequently. But we're very excited about this bill. We had a hearing a couple of weeks ago and had testimony from 15 organizations, a number more submitting written testimony. And, kind of circling back to where we started with all of this, we really see comprehensive school behavioral health as the most promising way to make sure that we're getting behavioral health supports to kids because they are in school. There are models for comprehensive school behavioral health that promote and support the behavioral health of an entire school population. So it's not just the kids, right? It is the kids, and the kids are at the center of it, but it's also their families and school staff, because behavioral health is really a community effort, right? And we need to make sure that everybody is supported in all of this. So the bill does kind of two things. First, it establishes a behavioral health implementation coordinating council to be led by the Department of Mental Health and the Department of Elementary and Secondary Education, along with the Behavioral Health for Integrated Resources and Child Project, or BIRCH project, as we call them, at UMass, which is a collaboration, I will note, between UMass Boston and UMass Amherst. So we have a nice cross-state collaboration there. And that fairly small coordinating council of experts and parent and youth voices are meant to develop a 3-year plan, a very action-oriented 3-year plan for implementation of comprehensive school-based behavioral health across the state, including, coming up with guidance and support for districts, paired with, right, because the BIRCH project runs that school-based behavioral health technical assistance center that I referenced earlier, making sure that the TA center is able to support that implementation as that rolls out. And then the other thing that the bill requires is implementation of that 3-year plan within 3 years. So every school will have to implement a comprehensive school-based behavioral health system using what's called the multi-tiered system of supports, or MTSS framework. MTSS is evidence-based. It's a systemic practice to support rapid response to students' needs across all 3 tiers of intervention, right? So you've got promotion and prevention, you've got sort of services and supports for intermediate needs, and then you have sort of more intensive supports for the kids with the most complex needs. We know that 3 years is a very short timeline. We also think that it, one, reflects the urgency and the need here, as well as being a achievable one. There are so many people doing incredible work in this space across the state. And now is the time. We have this window. This is where we need to be focused. This is where we need to invest, because we can't afford not to. We need to make sure that kids have the supports that they need. So why this bill? Why do it like this? There are disparities in access, quality, and delivery of school behavioral health services throughout the state. Systemic racism, vast inequities are impacting the current distribution of services and the quality of care kids are receiving. In many under-resourced schools, where the majority of students are children of color, they lack access to clinicians, adequate interventions, and resources to provide culturally relevant and appropriate care. And this builds on the ABC Act. There's momentum right now, and it's a viable solution, right? We can implement these systems that exist, that are evidence-based, and we can really move forward, but we need to make this a collective community effort. Again, like I was saying with the school Medicaid bill, right? We have 406 districts across the state. We can't keep going city by city and town by town. It's going to take us far too long to ever really make the inroads that we need to make. And so that is why having this statewide coordinated plan is so important. And we don't love council, commission, and task force bills, but this council is really different. It's a cross-secretariat approach that brings together the right people to make sure that we can develop a comprehensive school behavioral health system that has the planning, coordination, and technical support that's needed to make this effective. So I'll kind of leave it there. I'm sure there will be plenty of questions, but I don't want to take up too much time, because I do want to make sure to mention there are lots of ways to stay involved with this effort. First, you can stay up to date with our newsletter and action alerts. I included quick links there, and I can also pop full links into the chat once I take down my slides. We are also having a school-based behavioral health summit next week. I think we might be creeping close to shutting down registration, might be there, but please do reach out. We might have a couple of seats available if anyone has a burning desire to come out to Regis College and join us. We are also in the process of planning a series of virtual lunch and learns on all of our bills throughout the month of January, culminating in a State House event at the end of the month. Details to be announced soon. So all the more reason to sign up for our newsletter. Stay tuned for that. And most importantly, make sure your legislators hear from you. It's so exciting to get to work with Senator Velis, who I think is a fantastic advocate and representative for all of you out in Western Mass. And you have a whole great cohort of other legislators out there, no matter which county you're in. So, help him out as chair of the committee and make sure that all of his colleagues are hearing from you guys on these issues, because it's so important. And, I know there's probably a range of experience with advocacy with legislators on the Zoom today. So I will just say all it takes is a couple of calls. It really makes a huge impact. So if you have any doubt that weighing in matters, it really, really does. So encourage you to reach out. And the campaign's always happy to help folks out if you have questions about how to do that. My email's here. I'll also pop it in the chat, and I'll stick around for the end to answer any questions. Thanks so much.
Great. Thank you so much, Courtney. That was a lot of information, and you have articulated it in a very wonderful way that is digestible, I think. And we have almost 80 people on with us, and so we're going to have questions for you. So I am really thrilled to introduce our next speaker. And before I do that, I just want to say I'm supposed to remind everyone to please put your questions and questions in the Q&A section, and we will read them off on your behalf when we go into the question and answer period. I did want to take just a brief moment to recognize staff from Rep. Mindy Daum and Rep. Saunders' offices who are here. And I also wanted to give a shout out to 3 board members of the Public Health Institute of Western Mass, Gloria Caballero Roca, Luz Lopez, and Kim Lay. So thank you for being here, board members. And of course, now it is a distinct honor to introduce Senator Velis. He represents the people of Agawam, Holyoke, Westfield, West Springfield, East Hampton, Southampton, Russell, Montgomery, and a sliver of Chicopee. Quite a district. Senator Velis is an Army veteran, a member of the National Guard who's been called up recently, an attorney, a husband, a father, and a basketball player. News to me. I'll have to get you on the court sometime, Senator Velis. He is also House Chair of the Joint Committee on Mental Health, Substance Use and Recovery, and Joint Committee on Veterans and Federal Affairs, and the Vice Chair for the Joint Committee of Elder Affairs, as well as serving on 4 other joint committees, including Housing and Judiciary. So quite busy. Thank you so much, Senator Velis, for joining us today and for your leadership. And I'm going to hand it over to you to talk us from your standpoint about these policies.
Jessica, thank you so very much, and thank you everybody who's here today. This is obviously such a critical subject matter right now. I would say it is the paramount subject that's out there right now. Always great to go after or to hear from Courtney as well. One of my favorite, if not favorite, testifiers in front of us. Certainly very active in front of our committee, and always a wealth of knowledge, to say the least. And I was chuckling a little bit when Courtney was describing the bill that I now call it, because it is there are a lot of words in describing that bill. So now I just say, send me more on the bill, and they know what I'm talking about, because I've given up trying to repeat the exact description, exact wording of the bill. So it's great stuff all the way around, and I'm just really, really happy to be here. I guess I would just start by saying, this really, really is a priority of mine. I just got off. The reason I was a little bit late is I was meeting with our Secretary of Education, Secretary Tutwiler, on this very topic. At the beginning of the school year, he attended the convocation for returning West Springfield teachers and educators. And he got up there and he sang, which was amazing. And we had some fun joking around about that just a little while ago at our meeting. But he spent a good amount of time talking about behavioral health, specifically mental health, and kind of the impact it's having on kids. So what I did is I followed him out of the meeting. I went up to him. At that point in time, I had not met him, introduced myself, and let him know that I share your priority, Mr. Secretary, and I want to work on this. I want to join forces, and I want you to view me as the legislative lead on this. And that happened to coincide with me spending a good amount of time inside of my district and beyond, just going and talking to kids. You know, I started to do what I was referring to as kind of these mental health listening sessions, if you will, where I'd go into a school in my district and I'd spend an hour and a half talking to the kids, immediately followed by about an hour and a half talking to, you know, adjustment counselors, guidance counselors, and really anyone, administrators, anyone who wanted to be there and talk about some of the challenges that they were seeing. And I would always leave there, whatever school I was in, whatever district I was in, whatever community in my district, and then beyond outside of my district. And I would always walk to my car, and I had these kind of dual competing narratives in my mind. On the one hand, there was a sense that I was just sad. I was sad because a lot of our kids, you know, kind of just let me have some really candid, to the point, this is what we're going through. But as I was sad, the competing mindset that I had was about the resiliency of the kids, right? The fact that they were willing to really come forward and say this. And I thought that was really important for many reasons, but for one very important reason that you folks have recognized in the roadmap is the stigma part of this, right? So typically what would happen, actually, before I even get to that, I want to say something I want to respond to something that Courtney said, and then I'll get back to that story. But the opportunity is now. I agree with that. And I remember I was at a conference. The Senate president sent me to a conference not too long ago in California. It was on this very topic. And one of the speakers came out and said, you know, we are at a moment right now where this window is open, this behavioral health, mental health, particularly as it relates to our youth. This window is wide open. Everyone recognizes that COVID had just a completely adverse, detrimental impact on our kids. I want to be very clear as I say that this behavioral health crisis that we're seeing long preceded COVID, but COVID certainly exacerbated it. And a lot of times that gets lost in things. There's many folks out there that think this was a direct response to COVID, and the data tells us much differently. Certainly that it was exacerbated, certainly the separation, the loneliness, the lack of social connections, but it wasn't the driver, it was an exacerbator of it. And I think that's really important to remember. But anyway, back to that statement about the window being open. As positive as I am about the window being open and this opportunity to kind of get out there and do really positive change and get out there and make some policy changes, whether it's school-based behavioral health or other, the opportunity is now. My concern is I think that window, I'm not necessarily sure how long that window is going to be open before. The attention span, the way that we process and digest news, what's out there, to Courtney's point and many people's point, Courtney's just who I heard when I signed on. The time to strike is now at this time, because I'm not sure, 3 years from now, 2 years from now, 18 months from now, if we're having a conversation like this again, that the opportunity is going to be just as ripe as it is right now. But I digress a little bit, and kind of going back to some of those conversations with kids. You hear one of the things that I was so pleased with, I guess, was their willingness to come forward and just tell their story, because stigma is a really big deal. And I would kind of begin. This is the story I started to tell by just saying to the kids, like, "What's going on? How are you?" Just a very basic, innocuous conversation starter. And we kind of slowly but surely get into more of the meat and potatoes, if you will. And then I had asked some type of question that got right to it, directly on point to some of the mental health stuff. And it was funny. It reminded me of my time in school, right? I'm not going to date myself, but where a teacher or a speaker says something and all the kids kind of look around and they're waiting for that first hand to go up to answer the question. One courageous soul finally does it. You know, to me, that's that stigma at play. And that was one of the things that I was sad about. But then when that first student opened up the door and talked and shared something that was on their mind, it was just a remarkable thing to witness. All of the hands went up and said many of the same things, but they shared their story. So the stigma, it's still out there, and it's still such a profound thing. But I left feeling a little bit better on this. And I think if our kids are engaged the right way, I think they are willing to come forward and share their story. And I think that's a really important thing, which also lends itself to, again, to the timing is now. Because one of the things that I want to say over and over again is anything we do, anything policy related or otherwise, our kids need to be at the table. Their experience, their lived experience it is impossible to quantify how important that is. It's like, and this is a whole nother story, but I'm a huge believer in peer support models and just hearing, you know, when the student next to you raises their hand and tells their story, it's disarming. It pushes back on stigma. It really lends itself to, you know, getting to solutions that actually matter. This is an area that I will say that it is more important than many other areas that those in my line of work are staying intimately connected to folks in your line of work, what I like to call, with my military background, the boots on the ground. Because this is an area that if we went ahead and passed policies, there could be a lot of unintended consequences if we don't capture accurately what is going on. You know, taking a look at the roadmap, which I thought was a phenomenal document, by the way, the social connections piece of it. This, for whatever reason, and I have a lot of thoughts on this, we could talk about this at other time, you know, we are still, you know, both before COVID, and even now, you know, our kids, our youth are more socially isolated than they've been in a long time. You know, you can even see it in the sheer numbers. I had a conversation not too long ago where someone from youth sports here in town in Westfield was telling me that the number of kids signing up for sports and things of that nature is down significantly. And obviously sports are just one part of it, but we need to do everything we can from a policy standpoint of encouraging those social connections. I couldn't agree more. I think many of you have heard, you know, my story, my background, how I kind of came up to this, came to being the chair of this committee. Much of it has to do kind of with my story and my journey with addiction and substance use disorder. And what I can tell you with absolute certainty is that a big part of my recovery is those social connections, meeting with people, talking to people, sharing with people with lived experience. It's really worked wonders for me. And I just know, talking to the kids and talking to the educators and talking to the providers, we need more of that. So stigma, the social connections, couldn't agree with you more. Social emotional learning, which I think ties into one of the bills that are out there. One of the real questions that I have, and I know there's probably people on this Zoom that could answer this for me, is, you know, how much of a conversation in our schools are we having about behavioral health, specifically mental health? I have real concerns about that. And when I say concerns about that, I also realize that we're playing with a completely, you know, I'll give you for instance, one of the things that Secretary Tutwiler just mentioned is that there is an organization in New York that's doing really good things for school-based behavioral health in Massachusetts, involved in many districts in our state. These are Massachusetts schools, but a New York organization. And one of the things that he indicated was one of the challenges, and that's more my word than his. The challenges was that, you know, there are so many disparities. If you look out into the Commonwealth at all of the different schools, all of the different socioeconomic statuses, all of the different everything that makes us different yet unique, beautiful human beings, has a real impact on this behavioral health stuff. And really, there's no consistency, and I don't say that in a pejorative way, but one of the reasons that I think the bill that I'm going to refer to as the bill, the one with a lot of words, one of the things that one of the main benefits of that bill is that kind of creates this policy across the board, this statewide policy with this council. But when folks brought it forward and testified about it, and I think it might have been Courtney who answered this question, one of the questions I raised, I said, well, look, I mean, what we know is that there are differences in all of our schools, right? For any number of reasons. And I think I used the analogy in my district, like what's going on in Holyoke is different from what's happening in Russell, is different from what's happening in Westfield versus what's happening in Ludlow. But this bill captures that, right? It recognizes that, we want to have this statewide council, if you will, but with the full understanding that there are things that separate our districts and that different districts are at different places. I guess in short, it's meeting people where they are. And that's a really important thing. And I always tell the story, I'm born and raised in Westfield, Massachusetts, and my mom was an educator in Holyoke for many years. And one of the things that she would always say to me was that at the beginning of the day, when her kiddos were coming in, one of the first things that was on her mind is from the time that the kids left school yesterday to the time that they're now in front of me again this morning, what have they seen? What have they been exposed to? What have they eaten? All of these things that, me personally, things that quite frankly, I didn't think about as much, I didn't have to think about as much. So again, that recognizing that there's idiosyncrasies in each of our districts and all of our policies and all of our strategies in meeting districts where they are is absolutely critical. Social media, I mean, where do I begin? I mean, social media, I think social media is just absolutely horrendous for everyone's mental health. But for kids, the seeking that social affirmation, that comparison, the amount of time that our kids are staying on their phones, the impact that's having on their mental health, the kind of the false comparisons that it's creating, that they look at someone, they look at the number of likes that they have, they spend the amount of time that they have on it, which is intimately tied to the social connections part of this. I've got really big concerns. My office is leading on something right now where we're spending a lot of time talking to the Attorney General's office in Massachusetts about, are there ways that we can really do a deep dive into this? And we are. And a big part of that is the algorithms, I would argue. The way our social media providers are able to target content to vulnerable populations. Some of the stories out there are absolutely just reprehensible, sad, really sad, the way that they're able to do this. And I don't think it's right. So we're trying to look at and kind of crafting legislation for a way that we can get at this. I know that there's federal legislation being contemplated right now. Call me pessimistic, and I'm normally not a pessimistic person. I consider myself a glass half full human being, but I've got real questions on the federal government's ability to pass any legislation, to include agreeing that today is Wednesday. So where I'm going, why I say that is because I think it's incumbent upon us as state lawmakers, if our friends in the federal government aren't going to act, that doesn't give us a pass to sit out. I think we have to do something about it. School-based behavioral health. To me, this is where the money is at, right? And I mean that literally, figuratively, and everything. And to me, I guess it's kind of a simple equation, if you will, or a simple thought process, right? For all intents and purposes, when kids leave school, assuming that they're in school, but when they leave school, in many respects, it's the Wild West in terms of trying to really formulate policies that are able to meet kids where they are and to take into account all of the differences, all of the socioeconomic things, all of the disparities, the disproportionate impact things. So when you talk about school-based behavioral health, there's any number of reasons to really pursue that. But I think the main reason to pursue is, and this is going to sound pretty, in many respects, we have a captive audience. And that's not the best way to describe it, but I think it's the best opportunity we have to get kids at an age, right? Like the data is very clear. We know that the sooner we're able to get to someone and get them the support and the resources they need, the better off and more likely we're able to help them, to prevent them from having challenges years down the road. And that's a really important thing. And that has far and wide, broad implications across the board. And I guess I would just finish with this. You know, I really want to lead on this. The Senate President named me the chair of this committee in February of this year. And I've started kind of this intellectual journey, if you will, of trying to learn as much as I can about it. And that just means meeting with people from all over, you know, from folks with 150 PhDs to kids in the schools with that lived experience and everything in between. So where I'm going with this is that if folks on this Zoom want to have a conversation, want to talk to me in further, have good ideas, have thoughts that they think could contribute to legislation, please, 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 I beg you to reach out to me. And the timing is now. I'll finish again with this. That window is open right now for us to do some really cool, positive things in addressing many of the things on this roadmap. But I'm not sure how long that window is going to be open, which will allow us to really come forward with the bold initiatives, the bold resources that this challenge is presenting with us with. This isn't something that we can get away with just putting a Band-Aid on it. I don't think it. We have to treat what is going on here. You know, we have an expression in the Army, you can't put a Band-Aid on it. You can't put a tourniquet on internal bleeding. You know, we've got a challenge right now. We've got a crisis on our hands. And the only way out of this is to go straight to it and deal with it head on. You know, putting Band-Aids on it and things of that nature will no longer work. And the moment right now does not call for that. Thank you.
Thanks so much, Senator Velis. Your ability to share your own personal stories and your clear passion for looking out for the rest of us comes through. And so I appreciate you so much, and encouraged, like you just did, panelists to follow up with you after if they have solutions. I love how you said that. If you have ideas and solutions, that's what you're looking for. So thank you so much for all your comments. We do have a number of questions. And I was wondering, Kelly, are you going to bring Courtney back onto the screen and I can just read the questions to you both, if that's helpful. I mean, they're there for you to read, but I'm happy to read them out loud. I did want to acknowledge that we do have some school committee members that are part of the participant group. One in particular, LaTonya Naylor from Springfield School Committee. And unfortunately, I think oh, there you are, LaTonya. Okay, I was going to say you're going to have to type your question, but would really love, LaTonya, if you want to lead us off with a question, and then we can jump over to what people put in the Q&A. I'll turn it over to you.
Absolutely. Thank you so much, Jessica. And thank you so much, Representative Velis, for your advocacy and your leadership on this. You and your team are doing a phenomenal job. I wanted to first kind of respond to what you said about the stigma. And I wanted to say what has been so great about the work we're doing. So I spearhead also a nonprofit called Parent Villages, and we do a lot of work with youth, and particularly around how do you address unorthodox ways of dealing with mental wellness and emotional support for our students. And one of the ways we deal with the stigma is we don't call it mental wellness and we don't call it mental health. We actually look at the result and the solution. What are we trying to get to? And so one of the things we've been able to do through work with the Community Foundation and the Community Music School, actually is what I wanted to say, but the Community Foundation has helped us to get there, and the UMass Center for Trauma and a few other partners, was really being able to focus on how do we create pathways to healing for youth. And so I'm leading this with a question, I'm getting there, by saying that I understand the black and white of what these bills say, but what I see that is missing immediately as somebody who has to deal with putting this in action and making youth feel like they're a part of and wanting to engage is how do we look at alternative ways to identify this, the outcomes, right? So we use arts and music as a pathway for healing. We taught youth coping skills. We taught them how to express themselves, creative writing, things like that. And what we found was the level of ability, and I'm going to end with this. We had one student who never would talk, but she wrote a whole poetry book that's now available and published on Amazon. And the reason she did that was because she felt empowered by the tools she learned in our program, right? And so when I think about having something that is school-based that kids are going to want to be a part of, that youth are going to want to be a part of, it has to be something that is going to be fun for them, something that's not necessarily going to say, I have to pour out my heart and everything that's going on every day to make you feel like this means mental wellness for me. But what tools can I learn that are relevant, that are exciting for me, that I can use later on? And how do we find a way for the state to acknowledge that music and arts are part of the recipe for bringing healing to our youth in our community, and also a part of the tools that they're able to use in order for them to grow into adulthood and still be productive and healthy mentally and emotionally? So that's my question. Hopefully,
That's great. And
gathered
thank
that.
you. Yes, and thank you so much for your leadership and all these creative ways you're partnering. So I'll put, it sounds like, are those types of tools and recognizing, different types of strategies to support youth, are they in any of these bills? Do either of you see that?
You want, you want to, however you want to do this.
So I can jump in. So with reference to the bills specifically, so there's nothing specifically calling out the arts within there. However, we've been really intentional about not being overly prescriptive. And part of that is, there's kind of three pieces to this, right? There's probably more, but I'm going to call out three. Part of it is that every district is different. We do need to, as you pointed out, Senator, we need to be adaptable and flexible. We cannot put a one-size-fits-all plan out there because that will not work. So we didn't want to be overly prescriptive for that reason. There's also just, a resourcing issue, right? There aren't enough resources right now within the system to do all the things that we need to do, which is not just say, like, I really try to push against the framework of scarcity, because I think there are a lot of resources out there. It's just a matter of how we direct them, right? And what we prioritize. And I think there's nothing more important to prioritize than youth mental health, because that shapes everything moving forward. So one of the things we're really trying to do with this, and I'm kind of jumping to a question that I see in the Q&A and answering this too. We want to make sure that the resources are there to do this well. We don't believe in unfunded mandates. We don't want to make this a burden on the schools. We're not going to require them to implement a plan and then say, figure it out, you're on your own with resources, right? And the school Medicaid bill I talked about in the beginning, that's a really nice little chunk of change to help to make some of this a little more sustainable, but that is not going to cover all of this. So we will be rolling out over the next couple of months a coalition of coalitions, and get in touch if you're interested in being part of that, to really push for the state to make a significant investment in school behavioral health. It's going to be a tough FY25 budget year in the state, I think, but looking ahead to FY26 and hopefully brighter days, right? We want to make sure that as we climb back up, that is something that is prioritized. And so not being overly prescriptive. Thank you, Gloria. Love to have you. We want to make sure that there's flexibility there so that districts have the ability to partner with organizations like yours, right? Because schools can't do this in a vacuum. So those of you working in, provider organizations, don't fret. I do too. We want to make sure, right? Because schools can't hire everybody in-house to do all of this work, and kids have behavioral health needs outside of school. We want to support those partnerships happening so that they have access to arts and music programs, that they have, if more of a sports gal, you have access to that too. Whatever it is that you find that support in, we want to really encourage that creativity. We want to make sure that schools are implementing evidence-based programming, but we want to make sure that there's diversity in that reflects what kids need.
So thank you. Go over to you, Senator Velis.
I was just going to say, I'm a really big believer in what you're talking about, right? With the arts and the music. And I have to be honest, my first exposure to that was in the veteran space for treating veterans with PTSD, TBI. I remember the first time someone approached me and said that, you know, when you're talking about the behavioral health needs of veterans with PTSD, you know, there's going to be some real empirical data showing that arts and singing and stuff of that. And I'll raise my hand and tell you, I was in the camp of no way you're getting a bunch of battle-hardened veterans to go there and pour their souls out and talk about it. And the results have been absolutely insane in the best possible ways. In fact, many veterans are saying it is the only thing that they will do. They won't talk about it, but they'll write about it. They'll write poetry about it. And not too long ago, I kind of started to say, well, what about one of this is kind of like a different approach in this space, which is exactly what you're talking about. And kind of going back to something that Courtney just said too, when you're drafting legislation, this is why I think there is a place for this type of stuff. If you are overly prescriptive, sometimes you can be held to that standard. I would rather there be, at the risk of probably a bad word, legislation that's a little bit vague to enable this stuff as research evolves, and you already know it's working, you're doing it, you're seeing it, to allow this to happen. The other part of that too is, and I think this really speaks to that, is that, you know, a program that works in one place, and I've already spoken kind of at length about this, might not work somewhere else. I'll tell you right now, I do this thing in my district where I go out and I just walk into a Boys and Girls Club, and first question I ask is, raise your hand if you think you can beat me in basketball. And invariably all their hands go up. So then what happens is we go out there and we have a basketball game, and we bring all these people, and we have elected officials versus kids, and the kids destroy us, but everybody is smiling, laughing, have a good time. I was talking to Senator Gomez about it last night. We're bringing a Holyoke game to a Springfield game, and the winner's going to go play the Roxbury team. Like stuff like that. I don't know if it's science, but I'm telling you right now, it's good for all of our behavioral health. We're all having a blast out there. We're all having a good time. And I really think in this space, there's an opportunity to think outside the box and get some real returns on that. So kudos to you on the program that you're working. I'd love to hear more about it. I'll leave that up to you. You want to chat sometime? Let's do it. I'd love to hear more about it and talk about ways that I can be helpful.
Thank you so much. Thanks, LaTanya. You can, feel free to just stay right there if you want to. One question that it's come up a couple of times is about the PE and health classes. Do either of you know what the requirements are? How do we hold the standards high? Who is watching that? Can you speak to both of those questions, Courtney?
So I should clarify. So we are not requesting that PE teachers teach mental health education. We just grabbed, legislation is a little bit of a blunt instrument. We took the section of state law that requires that all students get physical education, and we add a section to that saying that they have to have mental health education too. And the only requirement there, and the thing that will kind of create the accountability and guidelines, is that it does need to be an evidence-based or evidence-informed curriculum. So they can't just say, hey, Courtney, in addition to teaching phys ed, you're also going to teach mental health education. Is that a subject you know anything about? No, go on Google and wing it. They are going to be required to use curriculum and make sure that whatever educator or educators are teaching mental health education, they are using curriculum that is developmentally appropriate for the age level they're teaching, and that it's evidence-based so that we know it's something that does work.
Okay, thanks. And maybe the last question I'll throw out, Senator Velis, I don't know if you have thoughts about this, but a couple of questions are, so when do we engage community-based organizations and school districts and school committees? How do we make sure the people who have to actually implement this stuff day to day are involved in creating or helping strategizing for advocacy? Do you have any thoughts on that? Or
I would just say, I think you're kind of doing that right now, right? You've got that mix of all different people, and I think stuff like this is absolutely critical. Yes, I mean, there are any number of really good pieces of legislation out there in all walks of life, on every subject matter out there, where you can look at it and say, this was passed 6 years ago, and this is yet to be implemented. This hasn't even happened yet, and I think we need to avoid that. So I would say that engaging all parties on this. Let's just say tomorrow, if I were going to tell you right now, this bill is dead, it's not going anywhere, and I most certainly am not telling you that at all. So Courtney, do not even bother sending me an email later on. It's not, I'm just kidding. Email me anytime you want. But what I am saying is that engagement, there is this, I'll be honest. So I am a state lawmaker. I never served at the local level. But what I will tell you is I have had countless conversations with friends on school committees, with friends on city councils, where they say, what are you folks doing? And it's not just an unfunded mandate thing. Sometimes it's like, we have no ability to do what you are asking. I want to have those conversations on the front end. So, because those conversations on the front end, a lot of times what happens is, let's just say hypothetically, we have a conversation. I go over to Parent Village, we have a conversation, and I flag something. And I bring that back to Boston and I say, Mr. Chairman, I just had this great meeting in Springfield and this is what I learned. And it's, we didn't even think about that. We're going to add this sentence. We're going to add shall instead of may, and we're going to add this. That is how good legislation happens. So it is absolutely imperative to be having these conversations just like this, bring them to scale, have them more and more, because they make all the difference in the world.
Okay.
And I always tell people, and for that matter, and
Yeah.
sometimes this is the one thing I want to avoid at all costs. The number of times that I've been on the Mass Pike, literally just pull out of the State House, get on the Mass Pike, I'm driving home, and my phone starts ringing. I start getting text messages, and it'll be from buddies of mine, and they'll have less than nice things to say to me. And they'll say, hey, I can't believe you voted for that, or I can't believe you didn't vote for that. And it's, well, Mikey, I'm just making up a name. Why didn't you tell me that 3 days ago? Why didn't you tell me that 2 days ago? The point I'm making is that good legislation is when people get together and have those conversations on the front end, as opposed to having to go back and fix something that has led to an unintended consequences. So now, to answer your question, 100%.
All right. And thank you so much. I'm so sad to say we are at time. We try to make it 60 minutes so we'll get more people to participate, and yet it goes by so quickly. But I think we've all heard you loud and clear. Speak up now, ask questions now, bring solutions now. And we at the Public Health Institute will certainly help. Courtney, if you have information or advocacy action that you would like us to send out, we can share it with this list and Western Mass can rally. So thank you both for all of you for being here and joining us, LaTanya and Senator Velis and Courtney, and thanks to the team, Andrea Freeman and Kelly Waldner, who are behind the scenes. So thanks everyone. We did put an evaluation survey in the chat. If you could please just fill that out. We're gonna have a webinar series in 2025 and we'd really appreciate your feedback. Like maybe it needs to be an hour and 15 minutes. But anyway, thank you.
Thank you so much.
Thanks
Take
so much.
care. Thanks for coming.
Thank you. Have a good one.
Bye-bye.